Thank you, Chrissy. Before I turn it over to Dr. Strang to give you an update on COVID-19, I want to acknowledge that our province has experienced its first death from COVID-19. To her family, there are no words that I can say to take away the pain and suffering that your family is experiencing today, other than I hope that you know this entire province has its arms wrapped around you as a family as you go through this very, very difficult time. Dr. Strang will now give us an update on the rest of the cases.
Thank you, Premier, and I too would like to give my extreme condolences and sympathy to the family of the individual that unfortunately has passed away from COVID-19. Today we are announcing 17 new cases of COVID-19, bringing the total number of confirmed cases to 310. Currently, we have 11 individuals in hospital, and 66 people can be considered to have recovered from COVID-19. A bit more detail: the individual that has died is as is in the press release, is a woman in her 70s from the Cape Breton area with a lot of underlying medical conditions. That's all the information that we will be providing on this specific case. It's unfortunate that this death has happened, but we do know the sad reality of COVID-19 is that people do die from this disease. It is a serious issue and a serious concern. It's why we're doing what we're doing. If we just did nothing and let COVID-19 blaze through our communities, it would be over soon, but we would have hundreds and hundreds of preventable deaths, people dying directly from COVID-19 and also dying from other medical issues that an overwhelmed healthcare system could no longer deal with appropriately and as necessary. It's why we are putting in place, and it's not just Nova Scotia, it's across Canada and around the globe, why countries and our province is putting in place very tough public health measures to keep people at home, to keep them apart from one another as much as we can. It's why we're putting in place a key focus in our healthcare system around detecting cases early through broad and rapid access to testing, and comprehensive and urgent follow-up by public health around any cases and their contacts. It's why we've announced on the testing side, we've announced yesterday we're no longer testing people just based on travel. In fact, we removed travel as a criteria because we know that we have some community spread here in Nova Scotia. We don't have wide community spread, but we need to be out in front of this to minimize any further community spread. We have established temporary assessment centers in communities where there's concerns about increased activity. We opened one up in Elmsdale and Enfield on Sunday. Today we are opening up a temporary assessment center in North Preston. There are concerns about increased disease activity as well as the patterns of how the disease is being spread and other underlying issues in these communities of North Preston, East Preston, and Cherry Brook that we need to understand more, and going in with a temporary assessment center is part of working with the community to help understand those issues. We're working very closely with community leadership and community leaders in these communities. They share the concerns and have their own concerns, and we're working very collaboratively to understand this issue. These communities are very concerning to me because they have the potential, if we don't get out front of and support these communities. We already know that we have cases in the broader HRM area that are linked back to these communities. We have cases amongst healthcare workers that have gone in through their work unknowingly and transmitting disease in some of our healthcare facilities. That is very concerning about how this could impact the broader community. As I said, the leaders in those communities are equally concerned and working closely with us. Unfortunately, there are groups in these communities that are, because of their willful not following the requirements to minimize social gatherings, to stop unnecessary social interaction, are a key piece of what's driving the disease within these communities. And that makes me very concerned. But it's not just these subgroups in these communities. Yesterday, it's broader in our community. People are not understanding and taking this disease seriously. Many folks may have seen it. I saw a picture from the Bears Lake Costco yesterday, where large crowds of people outside the store, well within the 6 feet of one another. I don't know what it takes to help people to understand that this is the kind of activity that actually easily spreads this disease. I know we're moving into Easter. People are anxious to get groceries, but we need to understand that you have to do this in a way that respects the requirements around social distancing and numbers. I talked the other day about responsible shopping. We need to, many of our grocery stores, the Sobeys and the Superstore, are putting significant things in place to manage and keep their store environments as safe as possible. But if people just crowd up outside, all that what's in the store is for naught if they're all crowded up outside and exposing one another there. So I bring that forward as an example that there are just too many instances of people still not getting it. And by doing that, you're putting us all at risk. I was in conversation today with my colleagues in the Labor Department of Labor around occupational health and safety, and they are going to be visiting all the grocery stores, the big box stores over the next couple of days, working with them to create as safe an environment as possible. But again, it can only be safe if Nova Scotians who necessarily going to those stores take the actions that they need to take to keep each other safe. This disease, today's tragic news, is a stark reminder that this is a serious disease. While there are people in our community, seniors, people with underlying health conditions that are most vulnerable for severe disease and dying, you look around the world, they're not the only ones. If you look even in North America, we are seeing previously healthy young people also getting severe disease and dying. This disease does not respect age. People, there are people, certain people somewhat of age that are at higher risk, but none of us are at no risk. If we don't do what we need to do, what the Premier and I have been talking about for the last few weeks, and what I emphasized the other day, that we need at least 80% of us, ideally 100%, but at least 80% of us doing the public health measures that help protect each other and doing that extremely well. All it takes is dipping down to 70%, and then the sacrifice that the 2/3 of us are doing is for naught. And then we will have a situation of a disease spread that's unable to be managed, a healthcare system that's overwhelmed. And if that happens, make no mistake, Nova Scotia is close-knit. All of us in our families will be touched by somebody who's severely ill and somebody quite likely dying. So it will affect all of us. So my plea again today is that all Nova Scotians, we need to come together, do what's necessary to stay home, keep apart from each other outside the home as much as possible, only go out into your communities if essential. If we can do this over the next few weeks, we will have a substantive impact, and we will together, we'll be able to look back on this and say, as Nova Scotians, we came together and we saved a lot of lives in our community. If we don't, then we have a different story to tell. So I'd like to tell the first story.
Thank you, Dr. Strang, and I can tell you I've sat next to you now for almost 3 weeks. I can sense, quite frankly, in your passion today and the frustration that he's feeling, because more than any of us, he knows there's two results to this. The one he described that none of us want to see is that more families end up suffering with deep loss, or the one where this is in our own hands, where we can follow the public health order, stay home, wash your hands, keep 6 feet away from people. That's not too much to ask. And if you heard the same frustration in Dr. Strang's voice as I did, you would know why. You would know why. Now we'll open up for questions.
Just a reminder that each reporter will have one question and one follow-up in the amount of time that we have allotted for today. First question will go to CTV Natasha Pace.
Hello. We have a couple questions for Dr. Strang, actually. The first one would be nursing homes. Wondering, you issued a new directive yesterday. I'm wondering whether or not all workers in nursing homes should now be required to wear PPE.
So that is an issue we're looking at. I know the IWK and the NSHA have announced today that their frontline workers should be wearing a surgical mask to minimize the chance of that healthcare worker potentially spreading the virus to a co-worker, to a patient. It's an area that we're actively looking at within the continuing care sector, as well as our community providers such as EHS. Quite frankly, we have to make sure we can do this in a way that respects our ongoing challenges around supplies of personal protective equipment.
Natasha, do you have a follow-up?
I do. This can be for the Premier or for Dr. Strang. You mentioned the photo that's floating around online about Costco. I was at some stores today. There's still long lineups, and as you mentioned, we are heading into the Easter weekend. I guess what's the message for people? Is there a concern that we could see a spike in cases if folks don't follow the directives that you've put out and start to gather, and especially as they're kind of all going into the stores in droves right now?
That's absolutely the concern. The way we prevent this virus from spreading, and now we do have it in communities in Nova Scotia, not widespread, and we want to keep it that way. The way we do that over the next few weeks is keep ourselves apart as much as possible. So anything that brings people together from across the community and puts them in close contact with one another just is where the virus spreads. That is why we need to separate, keep as much to our homes as much as possible. Yes, I get it. Some people are going to work, still have to go to work. We're asking them to do that. Every household needs to get groceries and go to get the pharmacy. But there are ways we can do that responsibly. Lining up in large numbers of people, cheek to cheek, outside of a store is not common sense, is not responsible. I'm baffled when I see a picture like that, quite that frankly. What are people what are people missing that what's been said over the last 3 weeks that they would somehow think that that's okay? And it's putting themselves at risk, but quite frankly, it's giving the virus a foothold that puts all of us at risk.
Next, we're going to go to the Chronicle Herald's John McPhee.
This is a question for Dr. Strang. I'm not sure how much detail you can provide around a person's death. You said that you're not going to go into details, but this kind of thing does raise concerns in terms of exposure and those kinds of concerns. We're told that she was being treated on the 3rd floor of the Cape Breton Regional Hospital, not in a COVID unit. If that's the case, are there concerns about other vulnerable patients being exposed to the virus?
So, John, I don't know where your sources are, but you have more detail than I have, and certainly more detail, even if I had it, that I would disclose publicly. We're always very concerned about disclosing some information that may disclose people's family's privacy. What I do know is that we have public health is working with the hospital right now with infection control and occupational health, like we do in every case where in a healthcare facility, to identify who may have been put at risk, whether they're another patient or a healthcare worker, and appropriate steps, testing of individuals, isolating them if necessary, will be taken.
John, do you have a follow-up?
Yes, I do. Just a quick one. So, can you say whether there is a COVID unit in that hospital on the 4th floor? Again, that's what we've been told, so we just want to confirm that's the case.
So I know there's a COVID unit in all of our regional hospitals, including Cape Breton Regional. I don't know the exact location within each hospital, but there are COVID units in all our regional hospitals.
Next, we're going to go to Global's Jesse Thomas.
Thank you, Chrissy. I guess 11 cases in total one death. I'm wondering, is this the week where we see things, begin to spike and get worse here in the province? And I'm just wondering how many people are in the intensive care unit of those 11 cases.
My understanding of the 11 that there are 4 that are in the intensive care and 5 who are in more non-intensive units. We continue to see the numbers go up and down. I fully know that we are going to get some kind of a climb in numbers, and at some point in the next few weeks we'll reach a peak. But I have to keep coming back to this, and I'm a broken record, but I will be a broken record because it needs to be said. How much that climb is and the peak that we get is up to us. It's the things that we've just been talking about that bring people together, that allow the virus to get more of a foothold in our communities, and then could put us in a position. If we need to look at is Ontario and Quebec, where they have wide community spread. We have a chance to avoid that because we implemented our tough measures 2 to 3 weeks earlier in our epidemic here in Nova Scotia than they did in Ontario and Quebec. That's not a criticism of them. We just have that fortune to be able to do things with a knowledge of and experience in other parts of the country, and we clamped down really early. But unless we stay clamped down and we have that minimum of 80%, hopefully a lot more than that, doing what's necessary, we will end up in a situation like Ontario and Quebec. And believe me, that is not a pretty picture and is not where we want to be as a province.
Jesse, do you have a follow-up?
Thank you. I'm picking up on your frustration and the broken record thing. I understand. I guess I want to go with the community spread. Can you just tell me what's your evidence of community spread and how rampant is it? I know we want everyone to stay home, but I think we need to understand the numbers to really, give people the knowledge and understanding that this is a scary disease. I'm just wondering, what's the evidence of community spread, and how many cases do we know now that have no relation to travel at this point or other known cases?
So if we look over all our cases that have happened over the last month, we still know about 90% of those are related to travel or contact with a known case. But if you look more recently, we have more and more cases where, even though it may be a contact with a known case, that known case themselves isn't clearly linked to travel. And we have a number of clusters of groups that people interacting with each other in multiple cases where the only explanation we have is that originally the virus got inserted into that group and from somewhere that must have come from the community and now is continuing to spread within that group within the community. You can draw your conclusions. We have stood up temporary assessment centers in the East Hants corridor and now in the Prestons and Cherrybrook. That is clearly what our epidemiology is showing, where we have increased disease activity and other factors that would require us to put the temporary assessment center in place. Having said that, we have cases across the province. And I remain concerned that if we focus too much on one community versus another, we miss the bigger picture that this is a risk for all of us across Nova Scotia. We need to be taking the preventive steps along with access to testing when necessary and appropriate in every community in Nova Scotia. Because quite frankly, if we have a couple of hotspots today, the way we stop it from getting in hotspots in more communities is by all of us paying attention and taking this disease seriously. Whether you're in Yarmouth, you're in Amish, you're in Halifax or Sydney, all of us need to pay attention and take this seriously.
Next, we'll go to CBC, Shayna Luck.
Good afternoon. Dr. Strang, this is a question for you. Just trying to confirm what I think I understood you to say earlier, that the death was at Cape Breton Regional Hospital. And further to that, based on what you do know about what happened at that hospital, is there anything that concerns you about the way that hospital handled this case?
Public health is working, as I said, working with that hospital, with infection control and occupational health to understand what happened from the time that patient was admitted into hospital, who may have been exposed to her, whether it's another patient or a healthcare worker. You have to understand this death only happened yesterday, and so there's an ongoing public health follow-up on this case. As I said, any healthcare facility, we always bring in infection control and occupational health.
Shayna, do you have a follow-up?
Yes, so, sorry, Dr. Strang, so am I understanding you correctly that was Cape Breton Regional?
So I haven't used those words, but you can come to that conclusion based on questions from other members of of the media. I think you got to understand that I am very careful always, and in the health system we are very careful always to only give necessary information to make sure we're not disclosing the private information of any individual or any other family. And I think the media needs to understand if they go beyond that, they're potentially doing that to a family.
I'll remind those reporters on the line to please put your phones on mute. We're hearing some chatter on the line. Next, we'll go to the Canadian Press. Keith Doucette.
Thank you. I'm just wondering, there was a contract signed announcement today with Stanfield. Looks like you're getting 480,000 gowns over the next 16 weeks. I'm wondering what that means to the overall supply of PPE in the province. Is that going to help? Is that only a fraction of what you need, or is it going to put you over the top in terms of being where you need to be in order to address this virus on the front lines?
Well, they've signed a contract, as you know, with the national government. We have a contract with them as well to supply us. That will build on what we currently have, which the supply, as I said yesterday, takes us for about a month, and this will add on top of that with the ability for us to order more, which I'm sure, if required or need to be, we will. And I also want to say there are other companies inside of Nova Scotia that are looking at, and hopefully we'll be able to communicate in a few days, that will be preparing and other parts of the equipment that we'll require to ensure that we have an ongoing supply.
Keith, do you have a follow-up?
Yeah, I'm just wondering what that supply looks like now. Are we in a situation where we could have potential shortages if we don't get this up and running fairly quickly, and it looks like we're going to? I'm just trying to get a status update in terms of where exactly we are with medical supplies for frontline workers.
So we have about a month's supply under current protocols. That would include the decisions that were made today by both the Nova Scotia Health Authority and the Advocate a few days ago. So we would have enough current supply for about a month, and when you factor in the orders that we've already put out, they'll take us into late May, early June in terms of supply.
Next, we'll go to Cassandra Nadeau-Lamarche with Radio Canada.
Good afternoon. So this is for Dr. Strang. So when calculating the number of cases per capita, so per 100,000 people, we are pretty much neck and neck with Ontario. So does that worry you? As yesterday, and you've mentioned it today too, you said that provinces like Ontario were 2 to 3 weeks ahead of us.
So I think it's a bit of a false conclusion to base the overall disease activity just on number of positive tests. You also have to understand what is the testing strategy. What's the likelihood that somebody who actually has COVID-19 is actually going to be tested positive? I think we have a very robust testing capacity. You've heard me talk over the last week how my admiration for my colleagues in the microbiology lab of how they've increased by 5-fold at least the number of tests they can process in a day. We've rapidly expanded our testing capacity, and we've removed the travel criteria. Ontario is a very, very different situation. In fact, they've had to back away from testing because their system is so overwhelmed. So I am much more confident and comfortable that we have a much greater likelihood. We're not detecting detecting every case. I'm not naive to that. But we are detecting the vast majority of cases here in Nova Scotia. And with an adjustment of our testing strategy in the last week in the lab capacity, I think we'll continue to have that ability. Other provinces, for a number of reasons, one of which that their epidemic was much further progressed before they were able to get their arms around it, are in a very different place.
Cassandra, do you have a follow-up?
Yes, and this one is for Premier McNeil. So this is in reference to my question from last week concerning the concerns of the Shedikamp community regarding the out-of-province fishing vessels workers. So we've heard that so now out-of-province essential workers, mainly in the fisheries industry, will now have to self-isolate. Why did you and Minister Colwell come up to that conclusion? Are you expecting it to have any impacts on the fishing industry economy?
That was always the case if someone was coming into work in our province, in whether it was in fishery or agriculture. That's one of the things you may have heard the national government has been talking about, temporary foreign workers coming into Canada. All the self-isolation protocols were around that. That is not something new. Potentially there was a misunderstanding about the fact that people confusing a fleet, someone on a boat, and those in fishing plants, processing plants. If you're coming into our province, regardless of where you're coming from, we expect you to self-isolate for the 14 days.
Next, we'll go to the Cape Breton Post's Nancy King.
Hi, my question is for Dr. Strang. Are you able to confirm whether the resident or the person who died from COVID-19 was a resident of a long-term care home?
As I said, what I've disclosed is the amount of information that I'm prepared to disclose, respecting privacy for the family.
Nancy, do you have a follow-up?
Yeah. What protocol is to be followed in the event that someone tests positive? I guess what's the protocol in terms of people who are in close contact with that person? How the testing from that point goes on?
So every time there's a positive test, that is communicated very quickly. We have an electronic information system that the lab then communicates that to public health. We have teams of people, and we're now actually working in shifts in public health because there's so many cases. Teams of people who then get that case. It's assigned to a lead public health nurse. Her job is to lead that team. We talk with the case where possible, or their family. We understand where that individual. First of all, we understand when did that individual become sick, and then during the time they could have been infectious, and we're now going to that 48 hours before they became sick. We work very carefully to say where were they, who did they interact with, whether it was a business that they were working at, whether they had gone into a healthcare facility, whether they were a resident of a long-term care facility, and then we make assessments about who are the people that we would consider that meet our definition to have been a close contact. And all those people that are close contacts, that appropriate steps are put in place to minimize their ability. First of all, we test them all right away, and then we put steps around them to minimize their ability that if they do become sick, that they're in a situation where they're minimize their chances of begin spreading it to others. It's that rapid identification of cases and all their contacts that actually is critical. It's one half of the critical pieces that are necessary to minimize spread within a community. If you know where your cases are and who their contacts are, and wrap a system around them to minimize them spreading the disease, that is the one half. The other half is all the broad public health measures that are happening in the community to minimize the number of cases that you have to take those second steps on in the first place.
Next, we'll go to News 95.7's Chris Halef.
Thank you. This question is for Dr. Strang. We mentioned it earlier, but the NSHA says that healthcare workers who work in patient care areas and other public areas will now be provided surgical and procedure masks at work as of this afternoon. This is obviously a great step forward in limiting the potential of the spread of the virus, but do you feel that this should have been implemented sooner?
No, I think this is a lot of the justification for this is actually of the fairly newly evolving evidence that we can actually have people who are what we call, the term we're using is pre-symptomatic, so they may be very mildly ill, maybe a little bit of a headache, a little bit of a scratchy throat, not enough for them to even maybe recognize until we go back and talk to them once they become more severely ill. Or people can be even asymptomatic and be somewhat infectious to others. It's the recognition of that, which is fairly new evidence of being conclusive around that is the justification for healthcare workers. This is not about healthcare workers being protected from the patients. It's actually about the healthcare worker who may be pre or asymptomatic and minimizing the chance of them spreading to a coworker or to a patient by wearing a surgical mask when they're providing frontline care. As I said earlier, we're looking at this for the rest of the health system as appropriate.
Chris, do you have a follow-up?
I do. This one's also for Dr. Strang. You touched on it earlier, but there seems to be a misconception in some that this virus impacts only older demographics. And that may be why people continue to ignore public health protocols, as you guys mentioned over at Costco there. You said this has the potential to have severe impacts on people of all demographics, all ages. Could you just elaborate on that and maybe explain to people once again that everybody may be at risk?
So if you look at how this disease is played out in places like China, which have kind of gone through their wave, we know that there are the risk of getting severe disease and dying is much higher in certain groups based on age and underlying health condition. But that does not all mean that there's no risk for others. So there is a certain percentage of people, of teenagers and above. We do know that younger children, it seems to be by and large almost all mild disease, but even teenagers in the 20s and 30s, a certain percentage of those people will get severe disease and some will die. Just not as much as people in higher risk groups. But I think it's important that people understand that. And if you have widespread of this disease, then you get significant numbers. So even if the risk of dying may only be a few percent in younger age groups, if you have large numbers of people in that age group who are infected, the actual total number of people who will die in that age group can become quite substantial. So it's important that everybody recognize that we are, as I said, we are all at risk to ourselves. But the other piece is that even no matter what the age group is, if you're not paying attention and you're spreading this around, you're putting others who have a much greater likelihood of a severe outcome from this disease at risk as well. So it's about ourselves, but even more so it's about everybody else in our community, and that we all need to do our part to keep everybody in our community safe.
Next, we'll go to Lindsay Armstrong with All Nova Scotia.
Dr. Strang, you said that provincial projections are coming shortly. Can you be more specific on when this will be ready? Are you expecting her to release something this week?
Sorry, I missed your question. The provincial projections. We're still working on that. We had another briefing today. We're looking at that to finalize where we're at with that, and what if actually how that's used both within the healthcare system to inform healthcare decision making and public health decision making, and how much of that then also gets communicated to the public.
Lindsay, do you have a follow-up?
Yeah, every province is taking a different approach to disclosing information. Ontario has released death projections. Newfoundland and Labrador is releasing cases by community, even breaking it down by suburb. We've heard the reasons why you're releasing less information in Nova Scotia, but people are confused why there's no consensus among your provincial counterparts on how to share COVID data. So how do we know that this is the best practice when provinces of all sizes are handling it differently?
So it's an area that there's a number of factors that go into the decision making. We are looking at, part of our looking at it, do we get a finer, I call it a granularity in the data we have. Right now we're presenting public data by a health zone. We're looking at ways that we can break that down, and we have some ways that we're certainly driving our public health surveillance. I think we all need to make look at there's pros and cons of every decision decision we make. And we're in the middle of looking at that, working with the Minister of Health, working with the Premier's office about what is the right level of information, balancing risks and benefits to do that.
That's all the time that we have for questions today. Go ahead, Premier.
Thank you, Chrissy. Dr. Strang spoke about the Costco lineup. We are not in the business of calling companies out or communities, but today we have to. Not only are too many people showing up at stores unnecessarily, when they get there, they are not physically distancing. Remember that 6 feet, 2 meters apart? All the science says it works. So for crying out loud, just do it. Keep your distance. It's not just shopping, though, unfortunately. We are now focusing on communities that we deem to be hotspots. We don't know yet, but we have mobile units testing. They're in Enfield and they're in East and North Preston. And while we are using resources, doubling down on testing, and trying to keep people healthy, the reckless and selfish few in some of these communities are still having parties. I can't even believe that after everything we've been talking about, some of you think it's okay to have a gathering or party. You are not only putting yourself at risk, you are putting everyone in your community at risk. And some of them work in our hospitals and long-term care homes. If they become infected and are not aware they're carrying the virus, they go to work and infect someone else, somebody more vulnerable than you. But if you are listening, know that every party you show up at and every get-together you go to could kill. You might not get sick, as Dr. Strang just explained, but someone in your family or your neighborhood or the healthcare worker down the street who has to go to work every day to protect us has no protection against you. Because you are the reckless and selfish, you do not listen and won't stop partying. Well, think about this. As you are planning your weekend, there is a Nova Scotia family planning life without their loved one because of this virus. This virus kills, and the only way we can kill it is if we keep our distance from one another. And for the love of God, stay home and stop partying, please, for the sake of our province.